I'm Dr. Sandhya Prasad, and I'm a board-certified psychiatrist in Bel Air, Texas. My practice is designed to address the needs of patients who have tried many other treatments, but they have failed. We have newer treatment modalities that many other practices don't offer, such as IV ketamine and Deep TMS treatment. In addition to either treatment by itself, we also offer the opportunity to do them together, and we've seen amazing results for several patients with that combination treatment. Early on in my practice, I had a patient that came to me who I felt very compassionate about. He was a young gentleman, very intelligent, who was in college and was struggling with his anxiety. He came to me and said he was going to stop going to college because the group presentations were too anxiety-provoking for him. We treated him, he got a lot better, and he got a job, and he had a supportive wife. But then he later became very, very depressed, even to the point of where I had to send him to the hospital. He actually got worse in the hospital, and I was very concerned about his suicidality. At the time, we had tried many medication regimens, none of which were successful. I had heard about ketamine treatment, and I presented it to him and asked him if he wanted to try it, and he said yes. After giving him just a few treatments, it changed his life. This inspired me to learn more about the treatment and to bring it to other patients. This particular patient is now doing extremely well. He's down to one medication. He exercises 5 days a week, and he's thriving. He really enjoys his life. After having success with ketamine, I wanted to be able to offer that kind of hope for treatment-resistant patients who aren't able to afford ketamine as a treatment option. Ketamine is a new, exciting treatment option, but it's not covered by insurance plans, and it can be expensive. Deep TMS treatment is an FDA-approved therapy that is covered by insurance. So I created another arm of my practice that accepted insurance to be able to offer this treatment. IV ketamine is a newer, cutting-edge treatment that is administered IV. It's very different than many of the other treatments on the market. It works on a different receptor, the NMDA receptor, instead of serotonin or norepinephrine. In my practice, when I see a patient for treatment-resistant depression, I don't just offer any one treatment. I look at them as a puzzle, and I try to address all the different pieces of the puzzle. With addressing all of these different factors, in our practice, we've been able to achieve a response rate with ketamine of approximately 80%. And this is in a treatment-resistant population, which is quite impressive. I administer all the infusions myself. I sit in the room with the patient the entire time. This has really allowed me to fine-tune the treatment to the patient. It's a very personalized process, and I think it's very important for the success of the treatment. My practice is designed to address the needs of patients who have tried many other treatments, but they have failed. We have newer treatment modalities that many other practices don't offer, such as IV ketamine and Deep TMS treatment. In addition to either treatment by itself, we also offer the opportunity to do them together, and we've seen amazing results for several patients with that combination treatment. My goal is to get to know the personal needs of every patient, because there's no cookie-cutter approach. What works for one person may not work for another. Spending a lot of time with my patients and getting to know them allows me to fine-tune a treatment plan that is completely specific to them.